In this video, I will tell you how to be very sure of your due date, irrespective of whatever anybody has to tell you. Okay, I'm making this video because I have got a lot of comments, women asking why their scan result is giving different dates and their calculation is giving different dates. Okay, so there are two very important things that you must do to be sure that your date is very accurate. So during pregnancy, you have 3 trimesters. Okay, so the first trimester includes the first month, the second month, and the third month of your pregnancy. The second trimester includes the 4th month, the 5th month, and the 6th month of the pregnancy, while the third trimester includes the 7th month, the 8th month, and the 9th month of your pregnancy. Now, during each trimester, an obstetric ultrasound is requested. Okay, it could be more than 3. It could be more than 3 times during the course of a pregnancy if there is any reason to request for ultrasound at a particular point in time. But if there is no reason, you should have 3 ultrasound done during pregnancy. In subsequent videos, I will tell you what each of them is being used for. But with regards to today's video, I'm telling you about this first trimester ultrasound. It is very important in the calculation of your due date. Actually, it is the best and the only way to calculate your due date using ultrasound scan. Another thing that you should know, so that you'll be very comfortable with your expected due date, is to be very sure of your last menstrual period. Okay, your last menstrual period, you can use it to calculate your expected date of delivery. But the problem with this pattern is that you may have mistaken your last menstrual period to be your implantation bleeding, which comes last before you eventually notice that you are pregnant. Okay, and these two, they occur almost at the same time. All right, so my previous video, I've explained how you would know if what you have is implantation bleeding or your normal menstrual period. So you may need to go and check that video if you have not seen it before, so that you can differentiate between your menstrual period and your implantation bleeding. So if you are very sure of your implantation bleeding and you are very sure of your actual last menstrual period, then you can use that menstrual period, the last menstrual period, to calculate your due date. And I'm assuring you, it is very, very perfect. Oh, it will give you the exact due date. But remember, your due date is not supposed to be must that you deliver on that very day. Okay, so it could be 2 weeks plus or 2 weeks before, around that particular time that you get using your calculation or obstetric scan that was done in the first trimester. All right, so if you got any value from this video, please hit the follow button now, share this video to as many friends as possible, and I shall see you tomorrow.